Welcome back to Living 757. Guys, you know that the COVID pandemic has changed life for everyone. But aside the coronavirus patients and their families, we need to talk about our healthcare professionals. These brave men and women from all over the place are not just putting their life on the front line to help us, they're also providing comfort and care for those that are affected by this virus. So, Living 757 and Coastal Virginia Magazine are going to honor them. Yes, we are going to highlight these amazing healthcare heroes every week from now and on. So, because of them and all the work that they do, we are in a better place. And I want to say thank you from the bottom of my heart. Thank you for your work.
Absolutely.
Now, first up this week, we are going to honor Mr. Gregg Shivers, and he is from Riverside Lifelong Health and Aging Services. Now, Mr. Shivers attended the medical school at Rutgers, and he completed his residency in Minneapolis, Minnesota. He started his career at Rappahannock General Hospital, and he even took his talents all the way to New Zealand and then came back to Virginia in 2010. He was appointed the medical director of Riverside Walter Reed Hospice in January of 2014, and now he is serving as the Associate Director of Patient Safety and Service Line Chief of Riverside's Lifelong Health Division. Wow. So many accolades.
Yes.
I didn't even name all of them just now, and that was a lot. So thank you so much. Thank you so much for everything you do. You are truly a hero.
Yes.
Absolutely. Absolutely. And up next, we have Tillery. Now, she is a native of Hampton Roads, and this is so cool because she just specializes in providing compassionate patient care, and she's been doing that pretty much since, for 11 years now. So congratulations to what Tillery is doing. She has a Master's of Science degree in Nursing Acute Care Adult General Technology, I believe, nurse practitioner degree. I gotta breathe when I say all of that. But big salute to her. She specializes in critical care medicine as well, and she just loves helping her patients and families who often rely on her to make the most difficult decisions. So big salute to you for what you do, especially right here in the Hampton Roads area. We certainly appreciate you, Catherine.
So much. Thank you so much to Catherine. And remember, guys, that we're going to be doing this every week. And thank you so much to Coastal Virginia Magazine also for their collaboration. So also talking about our professional providers, we have to go to another professional. You know, guys, that the cost for the knee surgeries can cost between $2,000 and $4,000. That's a lot of money. But to talk about this, we're going to welcome now Dr. Kuhn. He has a new treatment for your knee pain. Welcome to the show.
Hey, thanks for having me.
Hey, Doc, how's everything going?
I'm doing great. How are you?
Hey, you know what? I was doing good until I saw all those degrees. I have no degrees in the back, so I don't know if this segment is going to make me feel good at all.
Oh, you got all that life experience, man. You're brilliant.
You know, I'll take that.
There you go.
That's a nice degree, actually, when it comes from our people that love us. You know, that's a nice degree. Oh, my God.
Thank you.
Doctor, welcome to the show. We want to talk about these knee treatments today. Can be very pricey. So I hear that there's a new treatments for knee pain. Can you just talk with us about that?
Yeah, you know, I want to start off by saying, so our clinic, we're a medically integrated clinic. So we have a medical doctor, we have a nurse practitioner, we have chiropractic, we have different types of therapies that we do. So what we really cater to are a couple different groups of people with knee pain. We have people that just don't want to have surgery. I mean, we refer people out for knee surgery when that's necessary, and there's people, they just won't go. So there's people that don't want surgery, so we cater to them. And then there's also people that because of some of their medical conditions, they can't have surgery. So we cater to those people as well. And what we try to do is come up with the best solution for each particular patient. So we do treatments called viscose supplementation, which that is an injection of a hyaluronic acid gel supplement. And what that does is it supplements the synovial fluid in the joint. So to make it real simple, it's like putting more cushioning in there. And we know that that's not going to give you a brand new knee joint, But for many people, it can give you several months, sometimes even longer than that, of really good relief from the knee problem. And then we couple that and combine it with different therapies that we have in the clinic as well.
That's interesting, because did you say disco? As in
disco with a V.
You said disco. I'm like, of course, they got good knees. They can dance.
When we give you the Visco, you might feel like doing disco.
Exactly.
Absolutely. And just seeing your book in the back, it says Return to Health. Now, I'm a veteran of the United States Navy, and I'm in my 40s, and I've been dealing with knee pain myself. Do you guys cater to veterans?
Absolutely. You know, I have an actual place in my heart for veterans. My uncle is a retired colonel from the Air Force. My father also served in the Air Force. So I tremendously appreciate your service and anybody that served. But yeah, we take care of lots of veterans in our clinic.
That's awesome. Doc, and some of these treatments, the injections, are they covered by insurance?
Yeah, so Medicare, Blue Cross, you know, most major insurances will cover them. And we take that on a patient-by-patient basis. So when patients come in to see if they can be qualified for care, we're going to get copies of their insurance cards and do the appropriate phone calls and check and see if their coverage and what their benefits is. But yeah, for most people, it's covered.
Absolutely. And I would assume with the patients that you would sometimes have definitely up there in age, what's the recovery time that they can expect with a situation like this?
So that's one of the best parts about this, and I'm glad that you asked that. It doesn't interfere with their lifestyle. So, you know, once somebody gets an injection, which that process itself, when our patients are with our medical team, when they come in for that injection, they're in that room for 15 minutes or less. It's very simple. We use an ultrasound guidance, so we have pinpoint accuracy of where the needle's going. Once the patient's done, they can go back and leave our office and go back about their life. Now, we wouldn't recommend on the day of the injection that they go out and walk 5 miles, but they don't have to be confined to a chair or a bed or anything else. They can go out and live their life.
They can definitely do disco.
There you go. Maybe the next day.
This is not downtime at all, so you can do it actually even in your lunch break. I have a quick question for you. People say that a run is not good for your knee, especially when you are more than 40s. Is that true or is that myth? Running.
I think it really depends on the person. So I am actually a lifelong runner. And it is true that, you know, that consistent beating on the knees can create wear and tear, but a lot of that has to do with the body's biomechanics. You know, how are your feet, your knees, your hips, and your pelvis aligned when you're doing that running? If you've got really bad biomechanics, it can certainly beat your knees down a lot faster. I get patients in my clinics that are 70 years old that have been running for 30, 40 years of their life, and they have their knees are fine, you know, so it's just
absolutely. Yeah, and this is why you are the doctor. Now, people can reach you here. Your contact info is right there. We certainly do appreciate you coming on the show and just giving us this information, as I'm sure many of our viewers can use that. So thank you very much, Dr. Kuhn, for being with us today.
I appreciate it. Thank you for having me. Everybody be safe and healthy.
Yes,
absolutely. Yes. Well, we are transitioning from body parts moving again to how is your youth keeping up and keeping moving when we come back? You guys stay right here.